Thank you. We've addressed some of the basic needs. There are so many more, and the huge barrier of stigma. I'm just wondering from all of you, what other barriers you see? There's some just logistical barriers. We don't have enough providers. Everybody has a wait list. It's incredibly expensive. We need case management, linking people with resources and help. How do you see some of these barriers affecting the populations you work with? And what are some ideas? Let's start with Allison.
I think there's a lot that we can do both on a micro and macro level. So I think on a micro level is just continuing to teach people how to empower and to advocate for themselves, because a lot of people don't know. I mean, for example, I thought I was going to my therapist appointments and my insurance was covering it and it was fine. I was paying my $20 copay. 6 months later, I'm realizing it actually wasn't in network and I had to pay back about $800. And I'm someone who helps people navigate through the health insurance system. And so I should know how to do it correctly and I should know these things. But yet here I was, didn't have the full understanding, and I got hit with a surprise bill of oh wait, actually you're not in network, so you have to pay all this extra money. So I think part of it on that level is continuing to teach people how to use their insurance and making it available to them in an easy, digestible way, because there is a lot of weird loopholes and areas that are confusing in that aspect. And I think a lot of times when people go in to talk about it, it's kind of back to that stigma piece of, I don't want to share this with them. I don't know this doctor. I don't know this provider. So why would I share something this personal about it? So I think continuing to build trust with those communities and show that it's okay. And I think a big way that there's been a lot of success that's been utilized is community health workers. They are dispensed and represent underserved communities. And what they really do is help people address the basic needs in their community. They help people, if they need help finding where a vaccine clinic is, they're able to find that. Do they need help finding the transportation to get there? So it's really making sure they're teaching people how to self-advocate and find those resources available to them. That's a really good use of listening to the communities that may have more access barriers and really using people that have had those experiences and giving them career opportunities as well as ways to teach others in their groups to lift them up and use that.
How do we find the community health workers? Do we have them up here in Summit County?
That is a good question.
We'll find out. We'll get back to everybody here because
I believe there are the Holy Cross Ministries.
Yeah, we do have Holy Cross Ministries does have community healthcare workers that are working virtually because of the pandemic, and we have a partnership with the People's Health Clinic, and so that's where you would find them. So the People's Health, but we do have them working and trying to, provide those that kind of support to people.
And who's the gatekeeper for that? Because we have our peer navigation line, and we'd love when we get some of these calls about just how do you negotiate this impossible system? Where would we hand somebody off who might not need therapy, might not need an intervention, but just needs to know how to negotiate all of this hard stuff?
I mean, with us, the connection is through the People's Health.
Okay.
That would be a location that you can talk to, because then the People's Health usually will refer the people who come with those kinds of needs, and then the community healthcare workers will then help them to be able to understand more whether it's housing or it's applications for Medicaid, or it's people who are undocumented and need to know how to apply for services for their children who are U.S. citizens. Or it's just really it's pretty endless. But I know here in Park City, it's through the People's Health that we have that connection.
That's great.
And I think another big thing with community health workers is for a long time, they've not been seen as like a valid career path. So it's been operated through grant funding and just like legitimizing the career, as well as finding more ways that they can use Medicaid reimbursements to pay for their services, like peer support specialists and case managers, I think would be another huge way to bring more community health workers into this field, I think is a big one. And people at my organization, well, we do kind of a piece of community health work with helping people go through the health insurance and apply for Medicaid. I think, we continue to see more and more that, people need help with billing. So our reach has always just continued to broaden, because there's just so much more than just once you're enrolled, okay, great, bye, see you later. It's not just that. It's, where do I go? How much is a copay? What is a copay? What is a premium? Why do I have to pay this on a monthly basis? Things like that. And I think Medicaid is one of the best programs, because it is so affordable for people. But I do think there's still such a big stigma on being on Medicaid is another one. So continuing to reduce the barriers of that and say, it's okay, you're on Medicaid, this can give you mental health options, and just expanding reach into more rural communities of providers in those areas.
Great points. And I'm really interested in just creative partnerships.
Yes.
To break down some of these barriers. And, Sister Veronica, you spoke a little bit with us when we had our pre-panel discussion about some of the things you've been involved in with the People's Health Clinic you mentioned, and also the Wellness Alliance. Can you talk to us a little bit about those partnerships?
Sure. So we're trying to be, more creative and trying to address needs. So with Holy Cross Ministries, one of the approaches that we have begun is really building more and more partnerships with different organizations here in the Summit County area, because we don't have offices for our organization here. But so we have a partnership, like I said, with the People's Health Clinic. So community healthcare workers from Holy Cross Ministries provide services, and the People's Health will provide the referrals. And so then we give the services. For me as a mental health provider, the People's Health Clinic provides a space for me to be able to work with clients, and I can come and meet with them in person if they choose to, because we know too that that's been one of the effective ways of creating and building that trust, is trying to meet in person and using all the protocols, for COVID. But also we have a partnership. Holy Cross Ministries has a partnership with the with Peace House. So we come to the Peace House and provide services as well for clients who needed the mental health services. But that is, definitely a way. And with the Wellness Alliance, we're trying to be even more creative. And okay, so we're providing, and like some of you were saying, it's great when you can have people who look like you who are providing those services. But it's difficult too, because sometimes people who are, like, for example, the community healthcare workers from Holy Cross Ministries, they live in Salt Lake. So it's always a trek coming and going and back and forth with a lot of the commute back to, Summit and back into Salt Lake. And so in a way, the fact that we are in a pandemic has really helped, so that people can stay over there and still provide the services via phone. A lot of time it's through the phone or Zoom. We do have clients too who have issues in using Zoom, or having access, or not being able to afford to pay for a plan to get minutes, or to get, internet. And so it's being able to help them and find out more about other programs. And I know when the pandemic started, there were a lot of programs that were helping to provide more affordable opportunities for clients to be able to have access just to internet. So there's a lot of different ways I think that we can go about it. I know that recently Latino Behavioral, another organization, another nonprofit, came to Summit County, and they're also in partnership with the People's Health Clinic and Jewish Family Service and other agencies too. So we just have to try to think outside of the box and be creative, I think, and that's going to be the way that's going to help to address a lot of the needs that we have.
And thinking outside of the box, I think, it's not always a therapy session. I mean, we need to have better case management
Yes.
that I'd like to talk about, and peer support, which I'd love for you to talk to us a little bit about, Sherry. I mean, yesterday we saw in action what the recovery community, and I see Brooks is on here, what they do to support each other. And they're so energetic about it. And somehow that stigma, although still there, is broken down. And I feel like we need to do a better job with this, with mental health. So I'm curious, Sherry, I know that you've been involved in some successful peer-to-peer support. What does that look like?
Yeah, I'm a big champion of peer support. I think it's one of the most important things we can do. And it's what many of the people who work at Connect do. It's people with lived experience who reach out and they share their story, they share their experience, but they also are trained, they have information on resources, and they're able to help walk people through that part of their journey in their life. It is one of the key things that can help break down stigma. It's one thing to have doctors and therapists and law enforcement and people in authority telling you you need to do something. It's another thing to have someone with lived experience say, how are you feeling? Tell me about it. What would work for you? What can we do to find resources and help for you? And so it's a whole different approach. We have a workforce shortage of mental health providers in our state and around the country. And one of the things I'm working on is to help build a peer workforce, because I feel that it so strongly that peers can really play a critical role in helping to fill some of those gaps and really be out in the front to help drive some of these changes. The other piece is case management, and I don't want to confuse those two roles because they're very different roles. They can be put together and they work well together, but case management is just such an important service that is just not available, and there are different reasons for that, but we need to make basic case management, accountable case management, reliable case management available to people. And both of those interventions are really cost-effective solutions. So often what we talk about is, it requires a lot of funding and a lot of work to be done to build that infrastructure. Peer support specialists and case managers are, we can train up a workforce. We already have one, and we just haven't gathered them. And we need to have jobs available, good paying jobs with benefits to help employ people and get them in our communities. So yeah, I'm a big fan.
Yeah. Well, and it takes us so full circle back to, some of just basic needs. If some of those needs are met, some of the mental health issues might not be as severe. So, I mean, I really wish insurance would reimburse better for case management, because I think it's therapeutic and I think it is such an important role. Nelson, are there any case managers? What do you think that model would be like in the schools, just to have somebody on the ground there to help people negotiate and navigate some of these systems?
Well, next year we are working to expand case management into the schools and have maybe a full-time case manager working with the families of students that are receiving therapy in the school. And I agree with a lot of what's said about community health workers and peer support and case management. And I think the insurance rates and reimbursement rates are a big part of that.
Yeah.
I would also say that just in general, the pipeline of providers and all types of providers, so that includes the ones I just mentioned, has a lot of real barriers in it, just like the other barriers that we've been talking about today. And the one that I focus on a lot is the social work exam. And I did not know this, and I was kind of ashamed to know this, is kind of notoriously culturally insensitive. And of course, I thought, well, I didn't really notice that, but that's partly because it was written for me, right? It was written for my culture. And so the providers we need the most in Park City and Summit County are Spanish speaking. Frankly, they're Sister Veronica, that's who we need. Bilingual, bicultural counselors, but they're the people that have the hardest time getting credentialed. And there are people that have masters of social work that have a hard time passing the test, not because they don't understand the content, but because they're not native English speakers and because the tests are written for native English speakers. So, Texas actually passed a law where they said if you get within 5 points of passing the exam, you can have a longer period of internship that you can practice as a social worker. So I think there are some structural reforms that can also make our pipeline work better, and scholarships and some other things like that, and some extra support to allow us to have the workforce that we need. But absolutely, peer support, case management, there's no reason 50-minute therapy sessions are made for insurance companies and therapists. They're not made for customers. And I hope that the pandemic has allowed us to have a more flexible service delivery system. I hope that we could do more 30-minute sessions via Zoom for that when that's what the customer wants. I believe in individual therapy, but I don't think it's the end all and be all. When a case manager goes to someone's house and when they do the dishes sometimes with people, that's very powerful. Peer supports, like Sherry was talking about, that is powerful and can change lives in ways that sometimes, the thing that I do can't. And so finding the right service that matches up with what the customer, the client needs, that's what we need to be working on, and not just matching them to, this is what we do and we pay by 50-minute sessions. That's an old way of thinking that doesn't work for people.
Something exciting that we're developing at Connect is a fund where we contribute to help people access care. So it might be the therapy session, it might be case management, it could be more peer support. And I'm really hoping as we unfold this and look into this, that you'll all be advisors on this, because I've already learned so much just in this discussion today. Sister Veronica, you talked a little bit about this in our pre-panel about that test, which is, as a social worker, it's a very difficult test, and it's not really reflective of the work we do. You had some great ideas about what Nelson mentioned about helping people pass that might be more reflective of the populations we want to serve.
Yeah, so I know that, and Nelson is also part of the Wellness Alliance with us, and we have had discussions about starting groups where we can help young people who are finishing their masters and working with the universities too, to be able to start preparing them to be able to, pass these exams. Another thing that we've talked about in the Wellness Alliance for Summit County is to begin to prepare people and recruit people and have them begin to think about fields like either social work or mental health or psychology when they're in junior high, when they're in high school, because we try to get them when they're already finishing, and that's a lot later in that period of time. And I think it's going to be more prime if we get them. Like, it's so exciting to see Jackie because she's a member of this community and she's a product of this community. So it makes us all really proud who live here to see someone who's in the community, who's responding in the community, and also sharing and providing services to those in need. So I think we need more Jackies. We need to be able to recruit more people at an earlier age so that they're invested. And I know that there's already creative programs happening in different areas. I was talking to one of the police officers who was talking about the Explorers program that they have for, high school and junior high school. So, so that they can start thinking about becoming police officers, and they're coming from the community, because then you're going to be so much more invested and you're going to feel like people do care, and they're going to help me to be more prepared to do this. But either mentoring, but that's one of the things we've been definitely talking a lot about, like how can we prepare people to be ready to take these exams, because we know that they're not designed for the BIPOC community, the Black, the Indigenous people, the person of color. So how do you learn all those strategies to be able to pass and be able to come give back to your own community?
How do we change the test so it's more reflective of the work people are doing? That's, and I think, testing is changing nationwide. We're getting rid of, SATs, ACTs, some of this very, testing that is not culturally competent. I mean, we need a course in cultural competence and, across the board for mental health providers, educators, everyone. And the test is an example of that.
And even just vocabulary, the way that you communicate with people of color when you talk about mental health. And in the way that we even have our own intake sheets, a lot of times it'll say, please speak to me about your psychiatric history. My clients have no idea. They're like, what? I'm not crazy. I don't have a psychiatric history. So I need to explain and ask, or has there been a history of mental issues in your family? So I usually say, oh, have family members had issues with anxiety or depression that you know of, or, have had to go to the hospital because they're having issues with their emotions. So it's really even just talking about that. And then they're like, oh, yeah, and then they can give you the story, but also the vocabulary. And sometimes we get stuck in a lot of gibberish that makes no sense to the common person. So being able to speak and meet our clients where they are, which is definitely one of the things we talk a lot about in social work, but it's a lot of those pieces when they start coming together. And I think it really, really helps. And I think that is definitely the cultural competence that you're talking about, that it helps us to be able to help them feel more comfortable and feel safe. And I know we've tried to be creative in some instances, because I know of agencies that have people who provide translations, but a lot of clients will come to me and they're like, well, I don't know if the person who's translating is really telling them what I'm saying.
Right.
So there you go with the trust again, and so, so being able to have a better understanding of where the people are coming from, and then we become just much more effective in the services that we provide.
And, the question is, should there be a required course in mental health, and cultural competence in mental health? And like we have in PE, I remember climbing that rope. Yeah. I don't use that at all, except when I feel anxious and think back at it. Like, why aren't we in, early intervention talking about some of these issues? We need to educate teachers, therapists that are white about cultural competence. We have to do a better job on all of these fronts if we're going to break down stigma and barriers. I'd like to pause for a second and see if there are any questions in our chat or from the audience, just spontaneously.
Yeah, Kathy, what you just said was an amazing question from our audience. And I'm curious if our panel could kind of speak to it. The question actually was, should there be a required course teaching mental health, just like physical health classes that were required around high school ages? And so I'm curious if this panel would see that as being something that we should add into school programming. And is there a way to do that and lobby our schools for it and lobby for funding?
I think definitely you can. For me, I see it as being a part of the health curriculum, because mental health is part of your health, physical health, mental health. And so we could incorporate it. I know that someone was asking about social emotional, which is something that I know that at the elementary, because before I was a therapist, I was a teacher, that we started doing a lot of and incorporating into the curriculum, the whole piece about what your emotions, that they're important, and the way that you communicate with other people. And they start when they're very young. I actually am working with a program. It's called Children for Peace, and I'm going to a preschool. And working with preschoolers and beginning to talk about ways that we can connect with each other in a way that's peaceful, and our hands are for helping, not hurting, and beginning to teach those concepts of both communication and sharing my feelings with 3-year-olds. So we could incorporate this. I know that this is very doable. It's not something that's impossible for us to do, and make it something that is not, more taxing for teachers, but more incorporated and more embedded, and then interdisciplinary things too, where other people from other fields can come and work with the kids and teach, which I have also seen in high schools in California, where I used to live.
It's really hard here to introduce anything into school curriculum. I mean, parents get very upset and say, there's a lobby that these things should be taught in the home. So, I wonder how we can break down that barrier and have people be more comfortable having the schools, our faith communities, all sorts of places take a larger role in educating about mental health.
So I was just going to jump in. I would say, I think there's progress has been made in the health requirement on a high school level, that mental health has been integrated into that to some extent. And some teachers have really been great about pulling mental health into that discussion. So I think that's important. I think also with very young children, we can be talking about mindfulness, meditation, being still, self-calming techniques that they can use, and just to help them be comfortable with their thoughts and emotions, and kind of acknowledge it. And then here are the things I can do to calm myself down. Here are the things that I can do to address that. And those approaches should not be too controversial, I would think, but you never know.
I agree that these are best woven into kind of the fabric of school. K through 12 is my belief. And I think that what people who are on this and who see it can do the most is to really represent to school boards that this is something you advocate for. Last year, there was an uproar over the safe schools being taught in Park City schools. And if you look at that curriculum, I think that it's very innocuous. It had a very positive message. It did not say anything that you could construe as negative. And there were parents that were against it. Some of them, frankly, were from Salt Lake, and some of them wanted to have a lawsuit. But I think it's important to counter those messages with the message of, actually, we support talking about mental health in schools, support having a dialogue, because those kind of, even if the Safe Schools initiative goes through in schools, that has a chilling effect on teachers. And I think teachers and social workers in schools need to hear that that is supported by parents and by community members as well. I think that's very important.
And sometimes we hear about that in the media, and this huge grandstanding opposing thing that makes everything more divisive. So I am interested in conversations, because I think, this is a barrier that I've seen is even starting to have the conversations, because parents are fearful that it plants a seed, having conversations about different types of families, about, different orientations, about substance use, about the LGBTQI, population. I mean, there's a lot of fear that if you bring these things up, they'll become issues. And we have to break down those barriers when we talk about equity, and be vocal members of this community, positive vocal members.
Yeah, Julieta actually had a really, really good point in the chat, which was people often reject what they fear. So how about incorporating parents into classes and trainings, and have parents and children work together toward mental health awareness, coping skills, etc. What a cool idea, Julieta. Thank you.
And it's a perfect opportunity to introduce Julieta, who is just starting, not even yet, at Connect Summit County as our program director. So we're so happy to have her here, and she's going to be a big part of this fund that we're developing and that we have money for, to try to help people access mental health services, and meet them where they are. It's such a tenet in social work, and I'm such a social worker at heart. That's my training too. So, I mean, it's something I think about all the time and all the systems that we interact with. So we're getting close here, and it feels like a Friday because this is the last state of mind that we have. But I want to finish by I always like to ask the miracle question. If you had all the resources and time, what would you do to help break down these barriers? And who's ready to answer that? I see Jackie thinking, so I won't go to her. How about Sherry?
Yeah, if I had all the resources, I would focus on housing. That would be one of the biggest pieces to this puzzle, is to help people be housed, and then focus on community-based services as far as case management, ACT teams, peer support, and really make those available and accessible to people. I think too often our conversations move to more of a medical approach, and we start focusing on psychiatric beds. And while that's important, and we need that in our continuum of care, a short stay in a hospital is important to keep people safe and, keep their families safe, communities safe. But if we don't have the community services, when the person is released, they are cycling through various systems all over again. In order to stop that cycle, we have to be the ones to do that through providing appropriate services.
Thank you. You ready, Jackie?
I think so. Yeah.
I saw light bulbs, and
yeah. Well, initially, and I think just because of the nature of the population I'm currently working with, housing is obviously my first instinct. Getting everybody housed stably and securely, which is just a huge fight right now. The housing market and the number of available units versus the number of people who don't have housing is a separate crisis. But I think once you get someone into a stable enough environment, then that's when the most effective interventions are going to be able to be had with their mental health. So making sure we're meeting those basic needs for our friends and our neighbors and our population here in Summit County and the state of Utah is the first piece, whatever that might look like: housing, transportation, making sure everybody has a bus pass. We're really fortunate in Summit County that the public transit is free and a pretty good system. That's not the case everywhere. So I think meeting those basic needs would be the first step. And then, like Sherry said, I agree, investing in those sorts of holistic approaches to mental health and the wraparound services, not just the therapists, making sure that there's enough of those is important. But I think setting up programs that are going to reach into all the aspects of somebody's life who is seeking services is really important.
Thanks. It's great. What about you, Nelson?
I'm excited about this blank check. I kind of am a believer in abundance. And so if we want more housing, instead of throwing more money at the same amount of housing, we just need to build more housing. I think we need a bigger and more diverse.
You're going in and out a little.
And we need a lot. Oh, I'm sorry. I think we need more housing and a more diverse workforce and more of a workforce.
Okay. What about you, Allison? If you had the resources, where would you start?
I think just because of my healthcare focus is universal healthcare for everyone, I think would be one of the first places I would start. Obviously, housing, completely agree with what everyone else has said. And another big focus I've not talked about it a lot is really looking at the criminal justice system and really seeing so many people with mental health and substance use disorders are just cycling in and out of the system. And I think that is a failure on the system. And there's a lot of policy changes that we could do to really give them the support that they need, because when someone is released, they really don't have a lot of options. And when you have a felony, there is even more and more, it's even harder to find housing. So I think really looking at that system and seeing how can we really set these people up for success when they are released.
Thank you so much for bringing that up. You know, that's a whole other topic that I would love to have talked about next year. But, you know, we have a drug court here in Park City. We're really working to, you know, have more options and availability and break down barriers for folks who have legal issues. Really important. Who else would like to chime in on the miracle question?
If I had all the resources, I think of wellness for families. Wellness is more than just mental health and physical health. I think it has to do with housing and food. A lot of times we have a lot of food insecurity, which I know we haven't really talked about in our community, but that's something that's very real as well. And sometimes just having access. I think that would be the big piece, the piece about access, because we're broken down to, you know, insurance, no insurance, Medicaid, you know, undocumented, documented, or XYZ. And so if I had all the resources, it would just be this opportunity. I mean, and we're talking also about glasses, eye care, and dental care, because those are all the components of wellness. I think it's a mental wellness is a part of it, but there's a bigger piece of the whole that I think, you know, we definitely need to be aware of, and we need to keep advocating so that more people have access to what they need, because that's one of the pieces that we're struggling with these days.
Absolutely. I mean, I think we talked today about what are some barriers, but what are some system failures too, that we need to get out and advocate to do better in this community, in the state, in the country, everywhere. So I really appreciate it. And I'm going to turn it over to Betty. I think that unless there are any pressing questions, we're ready to wrap up. And thank you all so much for your time.
Thank you so much, Kathy, and thank you to all of our amazing panelists for being willing to just be so honest in this conversation. It truly has been eye-opening for me. And as we close this session, I just want to remind everyone, or let you know for the very first time, that there are a number of, Charles, I need a moment, please. Sorry, I had a child just come home from school. This is life. Yes, you may. So I would like to let you all know that there are a number of bills that are about mental health within our legislative session right now. I'm going to go ahead and put information about them in the chat. And there's a link to finding your state legislator in the chat. And we'll also send these out, or at least have them probably in our blog post when we kind of wrap up this event in a nice, pretty bow. But I think that one of the things that I'm seeing from all of these panel discussions is we've got to start advocating, right? We have got to start being the person or the people who contact our representatives. And Rachel's correct, House Bill 161 is no longer on the table. However, if you're in support of that, let your legislator know that they messed up by not moving that out of committee. So those are some things that you can get involved in. And we just want to remind you that if you or a loved one is struggling with their mental health, if you need resources, as long as you're not in crisis, please contact Connect Summit County's peer navigation line. We connect people to our community in need of mental health resources, and those who offer mental health services that may fit within the needs of that community member. So with all of that,
And I want to point out, we have Spanish speaking peer navigation too. So we're really encourage people to call. Also, just want to do a little plug for our scholarship fund. This is in development. This talk is going to help us immensely to sort out what the gaps are and how we might help Summit County residents access mental health. So you'll be hearing from us again. I consider you all on our advisory board now on this issue. And just thank you so much for being a part of State of Mind. I want to invite if any of our other Connect folks want to have any other closing remarks, but thank you all so much.